Samantha.
Hello.
It's nice to
Nice
meet
to meet
you.
you.
We're just doing an interview, basically just going from head to toe, so that I can get a feel of what's going on with you. Just first time getting to know each other before we do a physical assessment. So, you're Mr. Norton,
Yes,
and how old are you?
56.
And what is it that you do for a living?
Construction. I have a construction company.
Do you work outside? Are you
Sometimes,
exposed to anything? Like, is it heavy lifting or office work?
There's a
or
fair share of that. Some of both. Yeah.
are you married
Yes.
with children?
Grown children.
And what kind of living environment do you live in? Is it rural or in the city?
It's rural. It's Piedmont. It's on the edge of Oklahoma City.
And is it house, apartment?
House.
It sounds nice.
Yeah.
Well, what brings you in today?
I have heartburn sometimes in the middle of the night. Sometimes like my esophagus is on fire, and yeah. And so I wanted to see what you thought about that.
Well, can you point to where it hurts?
I basically wake up in the middle of the night, or early, a few hours after I go to bed, and it might be like burning right about here, I guess, like on fire.
Is there anything you try to avoid so that it doesn't happen?
Yeah, I try not to eat before going to bed, and try not to, have anything acidic or too acidic. But
How often does it occur? Like, say, per week or per month?
a couple times a month, something like that.
Okay. And how long has this been going on?
6 months or a year.
And how long does it last when it occurs?
Well, I immediately get up and do Tums, and then it goes away pretty quick.
Does it radiate anywhere to your back or your jaw, your shoulders, nothing like that?
No.
Okay. How bad is it on a scale of 1 to 10?
8.
Okay. And
Come on.
Tums helps.
It does.
Does anything else help to alleviate?
I just do Tums.
Okay. Well, as far as your history goes, what kind of surgeries have you had?
Not much to speak of.
Okay. What kind of medical problems do you have? Have you ever been diagnosed with anything?
Not diagnosed with anything.
What about your family? What family?
Basically healthy.
Okay. What about your family's medical problems as far as anything that your mom or dad or siblings
Nope, they've all been pretty consistent.
living into about what age?
80s. Yeah, pretty much 80s.
Okay. And you're pretty healthy. Do you exercise on a regular basis?
5 days a week.
Okay. You eat healthy? What kind of
I try
things do you eat?
to eat pretty healthy. Kind of an anti-inflammatory diet. So I try to keep it down on the meats and up on the veggies, and
Do you drink
Yeah.
alcohol?
I do
How much do you drink?
a couple drinks a night.
Okay. Now when you say a couple drinks a night, something big, something small, like what does that entail?
A mixed drink. So with 2 shots, I guess, of liquor.
Okay. So you have 2 of those to where it's like a total of 4
One.
shots a night?
Or 1 or 2. Sometimes just 1.
Okay.
Yeah.
Do you smoke?
No.
Okay. What kind of hobbies do you have?
Skydiving.
When you exercise, do you, is it cardiac or weightlifting?
Oh yeah. Cardio 2 days a week and weightlifting 3 days a week.
Okay. For about how long?
45 minutes each day.
Okay. Do you have any allergies?
seasonal, hay fever, I suppose.
Or do you want any medications, including over the counter? I know you've got tons on your list.
Nasacort.
Okay.
I do that each morning and it keeps it at bay.
When was your last, like, just head to toe general exam?
6 months
Okay.
or something.
Pretty regular.
Mm-hmm.
Okay. Well, I bet sleep, I guess, would be the other thing, right? Did you sleep well on a,
I do sleep pretty well.
okay, how
Yeah.
many hours a night would you say?
6.5.
Okay, so you're not waking up at odd hours,
Not really.
just even with the, I guess with the reflux or heartburn, you
Yeah.
know, just a couple times a month.
That's
other
about
than
it.
that.
Other than that, I sleep pretty good.
Okay. Well, let's just go through, well, we'll do head to toe.
Okay,
So I'm just gonna start with your eyes. Do you get regular eye exams?
I do every year.
Okay. Don't have any vision problems? Or,
Mm-mm.
okay.
Just readers.
Okay. No burning or anything like that?
Mm-mm.
Your ears, do you get regular ear exams? Any hearing exams? Or just your general annual checkups?
Yeah, just the general stuff.
Okay. And no problems with ear infections or?
Nope.
Okay. And your nose, you have hay fever. Do you have any other, like, frequent sinus problems?
Nope.
Okay. And your mouth, do you get regular dental exams?
I do.
How many times a year do you get?
Oh, twice, I suppose.
Okay. Do you have any problems with your teeth or gums or sores? Okay. And your skin and hair, is it pretty healthy? You don't have problems with your hair falling out, or, you know,
No.
some people with their have thyroid problems with a heat intolerance or problems with cold. Nothing
Nope,
like
that's
that. No lumps and around your neck or that you're aware of.
Mm-hmm.
Okay. Any neck stiffness?
Nope.
Mobility problems? Okay. And you swallow fine? You don't have any problems there?
Just fine.
Okay. And your perception of your health is that you're pretty healthy?
Yes.
Okay. How about your chest? Do you have any lung problems? Have you had any problems with shortness of breath or chest congestion or a cough?
Mm-mm.
All right. Do you have any chest pain? And as far as looking at your heart, have you ever had chest pain?
No.
Okay. And no dizziness or lightheadedness?
Mm-mm.
No problems with swelling in your legs?
Nope.
Okay. What about just kind of moving down? Do you have any stomach problems?
No.
Other than the reflux that you were talking about?
That's about it.
Okay. No intolerance to foods?
No.
And any problems with your looking at your prostate, your urine stream, or hesitancy where it's, you know, hard to get it started, or frequency
Pretty good flow.
where you're up and to go into the bathroom on a regular basis?
Nothing unusual.
Okay. How about constipation or diarrhea?
Nothing.
No burning?
Mm-mm.
Okay. And as far as, and share with me as much as you want to share, but it's as far as like sex goes, I briefly touch on that just for your health history. Your sexual, or you said you're married,
Mm-hmm.
and that's, as far as that goes, and everything's good there.
Mhm.
You don't have any problems.
No.
Okay, well, let me know if you do, because, you know, I can refer you, or, you know, we can take care of that. Any weight changes?
No.
Okay, do you weigh yourself on a regular basis?
I do, yes.
How often?
Every week or two at the gym.
Okay. Have you been more tired recently, or any kind of problems with fatigue?
Nothing.
Okay. see. What about high blood pressure?
It's normal.
Okay. And you've never been told you have any kind of history of coronary artery disease or peripheral vascular disease or anything like that? Your hands and feet stay warm, you don't have any numbness or tingling?
Nope, none of the above.
Okay. And your appetite's been good?
It is.
Okay. Well, trying to think of what else. No problems with your joints? Arthritis? Okay.
Nope.
Any skeletal problems? Sometimes a lot of people have problems with low back pain or musculoskeletal pain.
Not really. A little bit of soreness from the gym sometimes, but it just goes away.
Okay. Any kind of do depression or anxiety or any mental health issues? Okay. Any kind of problems with your blood? Sometimes anemia or anything like that. Have you ever been told?
Not that I can.
You
Not
don't
that I'm
have
aware of.
fever. You haven't been sick recently or running a fever or had any kind of exposure. Okay. Have you ever been exposed to any kind of toxins? So, I know construction sometimes people get exposed to different things.
I probably have been around asbestos, over the 35 years I've been doing it. But no, but nothing documented or
Okay.
probably, but yeah.
Okay. Any kind of metabolic issues like thyroid problems or diabetes that you're aware of?
No.
Okay. Do you take any kind of hormone supplements or anything like that?
Nope.
Okay. And you've never had any problems with hormonal imbalance?
No.
All right. Well, we'll get started on your exam.